Welcome back. Well, January is Cervical Cancer Awareness Month, and CHI St. Joseph Health is encouraging women to make cervical cancer screenings a priority in the new year. Want to welcome in RN Tracy Colon, the Yes Ma'am, Yes Serve Clinical Program Manager. Thanks so much for coming in.
Thank you for having us.
Absolutely. Let's first start off with the significance of Cervical Cancer Awareness Month.
Well, January, as you mentioned, is Cervical Cancer Awareness Month, and we want women to be educated about cervical cancer and the importance of their screening. I really want women to feel empowered to go ahead and make those appointments and have those screenings done and take control of your health in 2023.
Absolutely. Let's get into it. What is cervical cancer for maybe folks who don't know, and also how is it diagnosed?
Okay, well, your cervix is part of the female reproductive system. It's located right below your uterus. When in childbirth they say you're so many centimeters dilated, that's your cervix that's doing all that work.
Yeah.
Cervical cancer is the abnormal growth of cells in that area. Scientists aren't quite sure what exactly causes cervical cancer, but we do know that it's related to the presence of a virus called HPV. So an HPV vaccine has been developed. So that vaccine, in combination with regular routine cancer screenings called pap smears, are sort of that 1-2 punch that will combat cervical cancer screening. Then the history of cervical cancer, it used to be one of the most common cancer-related deaths for women.
Wow.
But because now we have this vaccine and these screenings, we've seen that go on a downward trend, and we're really hoping that trend continues.
That's good. Are there any symptoms?
Well, it's a sneaky cancer. Unfortunately, in the beginning stages of this cancer, there won't be symptoms.
Yeah.
And that's why it's so important to have these screenings to catch this cancer early. Some of the later symptoms after the cancer has already grown are very general, and as women we usually write them off to other things.
Sure, yeah.
Something such as abdominal pain or abnormal bleeding. So again, just the importance of having these routine screenings done consistently is the best defense against cervical cancer.
Absolutely. Let's get into that screening, the process, and also who should be getting screened, who perhaps is more at risk as well.
Okay, well, the best screening is your pap smear, and that can be done in a physician's office. Takes 10 minutes or less to do, and you can return to your normal activities that day.
Okay.
As far as when we should have these done, I always say check with your provider because they know you best. But as a general rule of thumb, these screenings should start at age 21 and continue about every 3 years until you're well into your 60s.
Is there any way that we as women can prevent cervical cancer?
Well, you always want to be healthy, not smoke.
Sure.
And eat well, exercise, but honestly, the best line of defense is having these screenings done.
All right, and let's talk more about the Yes Serve program and also who qualifies for assistance in all of this as well.
Well, the Yes Serve program is available at CHI St. Joseph Health. It's part of our mission and ministry, and it's offered in combination with our Yes Ma'am program. We offer mammograms and pap smears, which will be breast cancer screenings, as well as cervical cancer screenings for women who are uninsured or underinsured.
Okay.
Most insurances will cover cancer screenings, but if someone does not have the coverage that will do that, or they don't have insurance at all, we have you taken care of at Yes Ma'am, Yes Serve.
That's incredible. Folks are maybe just looking for some more information about this or to maybe register for an appointment. Where can they find all of that?
Well, we do have a website at CHI St. Joseph Health. It's Yes Serve, CERV program. Or you can also contact our team at Kentucky Cancer Link to help make an appointment.
Well, such an important reminder, I think, for women, and something that all women should be talking about, no doubt.
Yes.
Tracy, thank you so much for coming in. We really appreciate you taking the time today.
Thank you so much.
Of course. We'll be right back with your headlines right after this.